Okay, Bantamers, we're going to take it a different angle here. This one's going to go after a little bit more of a hip mobility and along with the thoracic mobility. So what I'm going to ask you guys to do is get wide in your stance here. All right. Take your right hand and reach and grab your left ankle if you can. If you cannot get to your ankle, grab your calf, grab your knee. Now I'm going to ask you to rotate your head and take the left hand and rotate all the way up towards the ceiling. Excellent. Now from here, you're going to keep breathing. Use the nasal breathing to facilitate the mobility. But now bend your right knee and shift everything to the right. You should feel that really pull in the groin. You might feel an additional pull in the lower back or the middle back. You're trying to shift right, then left, right, then left. Use some breathing in there. It doesn't have to be a fast shift. It can be a slow shift. Trying to use breathing to help facilitate that mobility. Okay? Of course, we do this going both directions. So come on back up. Let's shift over to the other side. And rotate up, shift to the left here. Use breathing and movement to help facilitate the movement. What are we feeling here, crew?
Hips and back.
Hips and back. Hamstrings. Okay. So you're getting a lot of mobility out of this, full body mobility. Okay? All right, you guys, good job. Let's grab the PVCs now. This is a semi-static but semi-mobile treatment and mobility action there. Now I'm going to ask these guys to put the PVC behind your back. Let's get the PVC in the crook of the elbow. All right. Now unlock your knees, get into an athletic ready position, engage your gut and your butt, screw your feet into the floor. Now paddle like you were in a canoe. Paddle going forward, shoulders. Rotate the thorax. Keep the lower half locked in. Right, this is a scapulothoracic mobility technique here. And then switch directions. Now you're going backwards. All right, this is going to get the scapulothoracic joint moving and prep for some of the shoulder stuff that we do, particularly overhead. Okay, so we do 10 or 15 each way. All right, very good. Let's take this PVC, let's bring it out front now. You're going to have your hands about the width of the shoulder, maybe slightly wider here. Again, I'm going to ask you to unlock your knees, get into an athletic ready position, and screw your feet into the floor, engage the butt and the gut. Pull out on the stick roughly 10 to 20% of your maximal force here. Engage nasal breathing and elevate that stick overhead. Stretch up and overhead, and then back down in front of your chest. All right? Now, with this technique, if you have it, you can potentially go all the way into a pass-through, but don't feel like you have to force that. Keep the abs engaged, rib cage down, open up the shoulders, use breathing to help facilitate thoracic mobility. Okay, say on the 10th rep, let's finish out overhead. Okay, still pulling out on that bar, still screwed feet screwed into the floor. Now laterally flex your torso to the right. And then laterally flex your torso to the left. Okay. Now with this mobility, as you work at it, you can add rotation here, whether it's to the front, to the back. Yeah, like Mary's doing here, okay? Just to get more access to different angles of the thoracic mobility. Okay, very good. Let's bring the stick back down in front of your chest. Let's bring your hands in just inside of shoulder width. All right, maybe not quite so narrow, Mary. All right, and now, again, unlock the knees, athletic position, everything's engaged. Now, rotate hands all the way over to the right. Very good. All the way over to the left. Now we're working the internal external rotation of the shoulders here. Let's do 5 of those. Okay, good. All right. Okay, gang, another technique for you to mobilize thoracic spine, scapulothoracic joint, and the shoulders.